isolation and, if necessary, local action where there are outbreaks. NHS Test and Trace will be vital to controlling the spread of the virus. It's how we will be able to protect our friends and family from infection and protect our NHS. And it does this by identifying anyone who's been in close contact with someone who's tested positive, asking them to isolate for 14 days in order to avoid unknowingly infecting others. And the system clearly relies on everyone playing their part. So I want to stress again today, we need you to get a test if you have coronavirus symptoms, a high temperature, a new continuous cough, or a loss of taste or smell. There is plenty of capacity, and everyone with symptoms is eligible. Everyone with symptoms. So please order a test from nhs.uk/coronavirus as soon as you develop symptoms. And we need you to isolate yourself if a contact tracer tells you that you have been in contact with someone who's tested positive. NHS Test and Trace started operating a week ago, and already thousands of people are isolating who wouldn't have been doing so before this service was introduced. And they are thereby protecting others and reducing the spread of the virus. So while we're going to all these efforts here in the UK to control the virus, we must also ensure we don't re-import the virus from abroad. So the second action I want to update you on is the introduction of public health measures at the border. Today, the Home Secretary has brought forward the legislation needed to establish the new regime from Monday. And I want to explain the reasons for introducing these measures now. When coronavirus started to spread around the world, first from Wuhan and then from northern Italy and other areas, we introduced enhanced monitoring at the border in an attempt to stop the virus from gaining a foothold in the UK. These measures applied at various different times to arrivals from China, Japan, Iran, and Italy, and required people with symptoms travelling from those countries to self-isolate for 14 days. However, once community transmission was widespread within the UK, cases from abroad made up a tiny proportion of the total. At the same time, you'll remember that international travel plummeted as countries around the world went into lockdown. So as a result, measures at the border were halted because they made little difference at the time in our fight against the virus. Now that we're getting the virus under control in the UK, there is a risk that cases from abroad begin once again to make up a greater proportion of overall cases. We therefore need to take steps now to manage that risk of these imported cases triggering a second peak. So just as we're asking people already in the UK to isolate for 14 days when contacted by NHS Test and Trace, we're also asking those arriving from abroad to isolate so that they don't unknowingly spread the virus. And there will be some exemptions for a limited number of people who need to cross the border, such as those engaged directly in the fight against coronavirus or who provide essential services. And we will review how the policy is working after 3 weeks. And of course, we will explore the possibility of international travel corridors with countries that have low rates of infection, but only when the evidence shows that it is safe to do so. The third point I want to make today is we need effective international action to reduce the impact of the virus across the globe. And this is the moment, really, for humanity to unite in the fight against the disease. Health experts have warned that if coronavirus is left to spread in developing countries, that could lead to future waves of infection coming back and reaching the UK. While our amazing NHS has been there for everyone in this country who needs it, many developing countries have healthcare systems which are ill prepared to manage this pandemic. So, to ensure that the world's poorest countries have the support they need to slow the spread of the virus, tomorrow I will open the Global Vaccine Summit, hosted by the UK, and we'll bring together more than 50 countries and leading figures like Bill Gates to raise at least $7.4 billion for Gavi, the Vaccine Alliance. Over the next 5 years, with the UK's support as Gavi's biggest donor, this Vaccine Alliance aims to immunise a further 300 million children in the poorest countries against deadly diseases like polio, typhoid and measles, again, saving millions of lives. This support for routine immunisations will shore up poorer countries' healthcare systems to deal with coronavirus and so help to stop the global spread and, as I say, prevent a second wave of the virus reaching the UK. This virus has shown how connected we are. We're fighting an invisible enemy, and no one is safe, frankly, until we're all safe. And again, of course, this is all contingent upon each of us continuing to do our bit. And as I never tire of telling you, let us not forget the basics. Wash your hands regularly and for 20 seconds. Wash your hands. Do not gather in groups of more than 6 outside. Always observe social distancing, keeping 2 meters apart from anyone outside your household. And I want to stress one final point which may be relevant today as the weather threatens, I think, to take a turn for the worse. Some of you may be tempted to move the gatherings you've been enjoying outdoors, indoors, out of the rain. I really urge you, don't do that. We relaxed the rules on meeting outside for a very specific reason, because the evidence shows that the risks of transmission are much lower outdoors. And the risks of passing on the virus are significantly higher indoors, which is why gatherings inside other people's homes are still prohibited. Breaking these rules now could undermine and reverse all the progress that we've made together. I've no doubt that that won't happen. I think the British public will continue to show the same resolve in fighting the virus as they have throughout this outbreak. We will get through this if we stay alert, control the virus, and in doing so, save lives. And with that, I'll now hand over to Patrick for today's slides.
Can I have the first slide, please? This is the slide of new cases, and as you can see, there is a steady downward detection of new cases through testing. So as of today, 1,871 today. It's worth noting, though, that, as I've said before, this is picking up those who are tested. And what we estimate from the Office for National Statistics household survey is the true number will be higher than this. And it could be somewhere around 8,000 a day. So this reinforces the point that we need to make sure we're picking up more people through testing to get closer to that number. The second thing to say is that because the R stays relatively close to 1, that means that this is not coming down fast. And so we have relatively large numbers still not coming down fast, and I'll reiterate what I said last Thursday, that gives relatively little room for manoeuvre. It means we have to tread very cautiously as we go forward. But new cases are coming down. Next slide, please. As we've seen previously, that's reflected in admissions to hospital, also decreasing, the slide for England there. And, of course, the number of people on mechanical ventilators in beds in hospital coming down across the 4 nations, but, as you will see, some variability with some ups and downs along the way. But everything moving in the right direction, slowly, but with a long tail. And as I said, the number of cases remains relatively high, not coming down fast, and the R quite close to 1. Next slide, please. The number of people in hospitals, of course, also coming down. Again, sharper in some places than others in terms of the decline, and with a relatively long tail, this will carry on for a little while longer, but the cases are coming down. And as you would expect, next slide, please. the number of deaths follows that pattern with, again, and this is good to see, a decrease which is coming day on day. But this also has this long tail. It's not coming down as fast as we'd like it to come down. It's likely to carry on for a bit longer. And it's worth reflecting that the people most affected by this have been the elderly, but also those from Black, Asian, minority ethnic groups, as highlighted in the Public Health England report, and those with other risk factors, including other diseases, diabetes, and so on. So we need to keep vigilant. The numbers are in the right direction. Things are getting better. They are coming down. But we have to stick with the rules of distancing. We all have to do it. When we all do it, then we have a chance of getting this down further, which is what we need to do, especially over the summer, before we then reach another period in the winter. We're entering the winter with the lowest numbers we can possibly get would be the best thing to do.
Thanks very much, Patrick. We'll go straight now to questions from the public, then to questions from the media. First to Amy from Brighton.
Spain recorded no new deaths over the last 2 days, despite a wide range of freedom across the country over the last 3 weeks, and new cases continue to fall. However, there has been no evidence of a second wave. Given this evidence, why is there concern over a second wave in the UK, and how closely are the UK government liaising with the Spanish government?
Really excellent question. I mean, obviously, we're learning everything we can from governments around the world, but I think probably I should defer to Patrick and Chris for comment on epidemiology in Spain.
Well, it's a great question, and it's fantastic news that numbers are coming down across Europe and have come down to low levels in Spain. It's also the case that if you look in other countries, they are beginning to see outbreaks as measures are relaxed. That's true. We've seen outbreaks reported in South Korea. There have been outbreaks reported in parts of Germany as measures are relaxed. And so what's happened is that the first peak has been suppressed. And as the measures are released, there's a danger that that comes back. There's also a risk that there's a second peak that comes as a wave goes across the world. So we're not out of this yet. It is good news that as measures are being relaxed, people are generally seeing numbers continue to go down. And that is obviously what we would hope for here, that as the steps that are being taken cautiously and we're measuring, that we will continue to see numbers going down. Chris, I don't know if you want to add anything to that.
Exactly.
Thanks very much. Thanks. I mean, a very important thought there, though, that there could be a second wave across the world, as though the pandemic, has its own kinetic force in itself. It's possible that there could just be a second pulse of this disease.
That is possible.
In fact, that's quite common. Yeah. So quite often with new epidemics, you get more than one wave before they're completely doing their bad work.
So all the more reason to keep going with the measures that we have. Can we go to Tony from Manchester? Tony from Manchester asks, myself and my husband are going back to work. Our children are not in the age groups to go back. What help is there for parents with no childcare options? And all I can say, Tony, I really do understand how you feel. It must be very frustrating that you're not in the group of that are able to send their children back first. As everybody knows, it's early years reception, year 1 and year 6. But we hope to get more primary school children back. We as you know, year 10 and year 12 are going to get some contact with their teachers. The best we can do right now for you, Tony, is to keep supporting you through the furlough scheme, through the coronavirus job retention scheme, through all the ways that we've been trying to help families. When it comes to specific childcare options and what may be available, I think you really need to look at our coronavirus website and see what we're doing to support specifically with childcare. But what we are doing is doing a huge amount to support families in terms of their income and their basic inability to go back to work. And as I said several times, obviously employers have to be reasonable. And if someone can't get childcare, then that is clearly a reason for them not to be able to go back to work. But we want to do everything we can to help you with childcare if we can. Anyway, we'll try and get more schools back in due course, but it is, I'm afraid, all conditional on making progress in fighting that virus. Let's go to questions from journalists. Tom Burridge from the BBC.
Thank you very much, Prime Minister. Should anyone be booking a holiday anywhere in Europe right now? What's your assessment? Are holidays abroad this summer going to happen? And what do you say to someone who's paid the deposit on their holiday and now has to decide whether they pay the full amount or cancel? And two questions to the scientists, please. Can you honestly look the British public in the eye and tell them that if a quarantine like this had have been put in place weeks ago, it would not have helped save lives? And also, did SAGE recommend introducing these measures right now?
Right, Tom. First of all, look, I'm not going to give advice on individuals' travel arrangements, but you know what the Foreign Office guidance is. The guidance is that everybody at the moment should avoid non-essential travel. Everybody should avoid non-essential travel. We've got to knock this virus on the head. In terms of the quarantine rules that we're bringing in, the reason for doing that, as I said just now, is we want to stop the possibility of reinfection from abroad. That's a vital consideration as we get the disease down.
Shall I? The SAGE advice from the experts in this area is that the measures like this are most effective when the incidence, the number of cases in this country is very low, and they're most effective when they're applied to countries with higher rates. That's the advice that was given from SAGE, and that's the advice that would have been true a few weeks ago, when obviously the levels were not very low here, and the transmission within the community was the highest source of infection. So the recommendation that came from the science was that this measure of control is most effective at those times. I don't know, Chris, whether you want to add?
Thanks very much, Tom. Let's go to Beth Rigby of Sky News.
Thank you, Prime Minister. Tens of thousands of people have gathered in central London, many outside number 10 Downing Street, deeply upset and disturbed by the brutal killing of George Floyd. They don't have the chance to speak to the President of the United States, but you do. What is your message to President Trump on their behalf? And a question to the scientists, please. I've got the coronavirus alert system right here, and it says at level 4, transmission is high and social distancing continues. And it says when we move to level 3, there's a gradual easing of restrictions. So I'm a bit confused. We're at level 4 in terms of the alert level, but the relaxation of restrictions is already starting. Is that not a cause for concern?
Well, first of all, Beth, let me answer your question about George Floyd. And we mourn George Floyd, and I was appalled and sickened to see what happened to him. And my message to President Trump, to everybody in the United States from the UK, is that I don't think racism or racism, it's an opinion that I'm sure is shared by the overwhelming majority of people around the world. Well, racism, racist violence has no place in our society. And you mentioned the demonstrations, Beth. All I would say is that I do think people have a right to protest, to make their feelings known about injustices such as what happened to George Floyd. I would urge people to protest peacefully and in accordance with the rules on social distancing. Everybody's lives matter. Black lives matter, but we must fight this virus as well.
Shall I take the second one?
Yes.
Prime Minister? So there were two separate things which I think people are getting conflated together. There's the alert level, which is set independently, on the instruction of ministers independently, by the Joint Biosecurity Centre advising the 4 chief medical officers. And independently of that, and this was the thing that was linked to changes, were the 5 tests that ministers set that had to be met before changes could be made. And those included things like being sure that the NHS could be protected and seeing sustained downward movement in deaths. There were 5 of those. The alert levels are for a different purpose, and the point of the Joint Biosecurity Centre is very much to try and help us to map out in some detail across the UK over time, and it's only just beginning, the hotspots in the areas of the UK where things are moving at a higher level than elsewhere, to go back to Sir Patrick's earlier point, that as we move into a lower incidence across the country, we'll increasingly move from a situation where there is a lot of coronavirus everywhere in the country to a medium amount. We're trending downwards, and the alert levels were clear 4, but with a direction of travel down. That was the unanimous view of the 4 chief medical officers on the advice, independent advice, of the Joint Biosecurity Centre, JBC. Trending down. But really, we're going to move to a situation where we have a lower level, provided we all stick to the social distancing rules, and it's absolutely critical we do, and we take things very, very slowly for the reasons that Sir Patrick said right at the beginning. We've really got to take this slowly. We will get to a point where there will be much lower level everywhere, but we will start to get flare-ups and outbreaks in different parts of the country. And really what the JBC is primarily going to help us with is actually to identify early those areas of increased transmission, those hotspots, so we can go in and try and find out how we can actually get on top of those before they spread more widely. This is very much something we've learnt from the first few months of this coronavirus. This is one of the critical things we need to do.
Thanks very much, Chris. Robert Peston from ITV.
Good afternoon, gentlemen. Question for the Prime Minister first. Your predecessor, Theresa May, yesterday said she was deeply concerned by the way that the quarantines being imposed on travellers to the UK are, in her words, closing Britain off for the rest of the world. And she wants you to take the lead in developing an international aviation health screening standard that would make it unnecessary to have those kinds of quarantines. Are you going to take your predecessor's advice and lead talks on devising such a scheme to get aviation going again, travelling going again? And to the Chief Scientific Advisor and the Chief Medical Officer, just picking up actually on what Beth said, Professor Whitty, one of the things you simply said just now was that the point of the threat levels was to basically advise, for example, on when we can have local lockdowns to tackle outbreaks at the local level. But one of the things we know from Dido Harding, for example, who's in charge of the whole test and trace process, is we're not going to have that data for another month, which makes many people concerned that the easing off of lockdown has happened a month too early. Could you just reassure or comment on that?
Yeah, first of all, thanks, Robert, on your point about what we can do to make sure that, insofar as possible, we allow people to fly safely. I mentioned earlier on the idea of safe corridors, safe travel between the UK and other countries with low or similar levels of infectivity, and we will certainly be developing that as we go forward. One of the difficulties about testing is, as you know, the risk of at airports is the risk of false negatives. But on the other matter, Patrick.
Well, I think it's Chris.
I'm going to give, if I may, quite a long answer to that, because I think it's a really critical question that people are asking. The thing to understand is this is a disinfection with which we are going to have to live alongside for many months, and probably longer than that. We've basically got to have a multi-layered defence against it. And at any given point, we can maybe raise some things and lower others, but we're going to have to go incredibly cautiously, as Sir Patrick said early on. And I'm going to run through all the things that we have to do, because I think it's important to understand each change in context. So there are a group of things we need to do to isolate those people who have the virus or might have the virus. And one of the problems with this virus is that it can be transmitted by people before they get symptoms. So the first and most important thing is people who do have symptoms must self-isolate straight away, and they must get a test, as the Prime Minister was saying. Secondly, the people they are most likely to pass it on to and who could therefore have the virus without symptoms are their own household. So therefore their household must isolate with them, and that has been the case right from the beginning of this epidemic. The new thing that has been brought in, and it is definitely, as you imply, in the early stages of its development, but it is definitely there and is definitely working, but it'll work a lot better over time, is the new element of test and trace, because the third group of people who are likely to get this are people who've actually got a high amount or high chance of having the virus because they've come into close contact with someone with the virus. And the test and trace, NHS test and trace model, is to allow us to identify the people who've got cases and then identify their contacts and ask them to self-isolate because they may have this without symptoms and pass it on. Then there's a group of things that we need, so that's the first group of things. Then there's a group of things we need to do in terms of reducing transmission at an individual level. And these include washing hands, as the Prime Minister repeatedly and rightly says, absolutely critical because you can pass it to yourself and to other people. If you're coughing, to make sure that you actually have no good cough, what's called good cough etiquette, where you use a tissue and dispose of it properly. The 2-metre rule, which is about trying to ensure that if you do speak, cough, or make other things which actually lead to droplets coming out and you're infected without knowing it, that you don't pass that on. And something which, again, we brought in relatively recently, the idea that if you cannot socially distance at 2 metres for a prolonged period, a moderately prolonged period, then you should use face cloths, and that's one of the things which is a new thing. So those are going to carry on really for as long as this epidemic continues. But then we've got the group of things which are around trying to break the link between households, because that is where most of the social distancing come in, and those are the things that were absolutely essential. Trying to reduce people's social contacts, including close friends and family, because actually very often those are the people who you will catch this from. All the things which bring people together, the things we all enjoy, like pubs, clubs, and restaurants and so on, these are things where we needed to close those down. Shops were closed down as a way of ensuring that you came into contact with as few people who were from different households. And of course, the initial large but not complete closure of schools. Now, in this group of things, we've really made very, very small changes, with the exception of the schools, which has been a small additional group to the people already at schools, the children of essential workers. Almost all the other things are to do with people meeting outdoors and asked to be socially distant. And that's because the risk of people being outdoors is very considerably reduced. But these are really modest and slow steps. And the final two things that we have to do is shielding, making sure that the people who are at greatest risk are away from the greatest risk of meeting others with the virus. And we made a very small adjustment to that, which is, again, because for many people this was incredibly difficult to maintain, to say, well, if you're just with a member of your existing household, you can go outdoors, or you can meet someone, but at a distance, only one person, outdoors only. These changes in risk are really very small. And then the final one, which it really is important to stress, because it is in the long run, the way we're going to get ourselves out of this, is research. Finding new drugs, finding new vaccines. Now, the reason I've listed all of those out is what we're making is small adjustments to some of these things, but this is a multi-layered defence, and all of us have parts to play in almost all of these. It's absolutely critical we all do this. And so we shouldn't take the fact that small adjustments are being made now to imply that this is suddenly lockdown over. What this is a slight reversal of some of the most onerous things on people, mainly outdoors, at a socially safe distance, the 2-metre distance. So I know that's a long answer, but I think it is important to put things in context rather than just to see them as one-off events.
Thanks very much, Robert. Tom Newton-Dunn from The Sun.
Thank you, Prime Minister. Question first to the CMO and the CSA, if they could possibly both answer this one. Testing capacity, we know track and trace is up and running. Could you say at what capacity it currently now is at? Is it 20%, 50%, 100%? We know it's not 100% maybe. And when do you expect it to be running at full capacity, full operating capacity? And before it gets to that stage, since Angela McLean has been very clear that having a fully operating track and trace system is crucial to unlocking the lockdown, are you comfortable for more measures to be released, such as the opening of shops or pubs or restaurants? And question to the Prime Minister. Prime Minister, this is my last question to you as the Sun's political editor. It's now clear that the nation will lose a whole load of jobs. Many millions of jobs may be lost by the autumn, by Christmas. Many of those will be Sun readers, probably tens or even hundreds of thousands. Are you able to guarantee to these people, none of whom have lost their jobs through any fault of their own, either new jobs to all of them, or if not, help or training to all of them to be able to get new jobs again?
Yes, sorry, but why don't you answer the first one? I'll come to Tom.
On the testing capacity, in a sense what we've done is play leapfrog to some extent. The capacity goes up, then we run to catch up. There are very many more things we could do with testing with greater capacity. And the key thing we need to do is do that systematically. We obviously started off with people who had severe disease, went out by stages, key workers, testing them if they had symptoms so they could go back to work in the NHS, social care and other areas. And we've now got to a situation where we can test people who've got symptoms in the general public, and that allows us to run the NHS test and trace system, which was not possible when we had less testing capacity. But the more capacity we have, the more different uses we can use for these testing for people who've got the virus now. And that allows us to do screening, for example, in care homes, screening in hospitals, and other things which will allow us to find the hotspots that we've got in terms of infection and deal with them. But you're absolutely right. We are not yet at sort of cruising altitude for this. The number of tests is going to carry on going up, and our ability to use the tests we've got is going to carry on going up. And this is going to carry on for quite some time before we get to the point, I think, that we're all satisfied we've got to the point we need. There's the additional point, which I'm not going to go into the details of unless you really want to on a follow-up, of antibody testing, which is an additional capacity we now have. And this can say reliably whether someone has had the infection several weeks ago, but we don't know whether it tells us anything useful about immunity or anything of that sort. But that's the other form of testing, and we're increasing the ability to do both of those across the UK.
And just to add to that, what Angela said is that an effective system in place is an important part of going forward, is an important part of being able to release measures, and as Chris has said, it's being built up. But I do want to stress it's not the single answer. So the idea that somehow having a test and trace system in containment absolves ourselves of all the other things we need to do is incorrect. We need to make sure that we carry on with the distancing and some of the other measures in place in order to control this. The lower the number of cases in the country, the more effective and the higher burden of load, as it were, can be carried by test and trace and making sure people isolate. But on its own, it's not the answer. It has to be part of the whole system.
And Tom, on your incredibly important point about what's going to happen as we as the months go by and the effect of this recession starts to bite. Yeah, and let's be in no doubt. Of course, I'm afraid tragically there will be many job losses, and that is just inevitable because of the effect of this virus on the economy and because of the shutdown that has taken place. And all I can say is that in dealing with that fallout from coronavirus, we will be as activist and as interventionist as we have been throughout the lockdown. There's no other country in the world, I think, has done as much, or few others that have done as much as the UK in terms of putting our arms around workers with the furlough scheme, looking after companies that have run into difficulties, helping in any way that we can. We will be just as interventionist in the next phase, investing in the UK economy, investing in infrastructure, taking our country forward so that we bounce back as sharply and as decisively as we can. That's going to be our approach. One thing I want to say is that for young people in particular, for whom the risk is, I think, highest of losing jobs and then being out of work for a long time, I think it's going to be vital that we guarantee apprenticeships for young people. I think we must have a huge, we'll have to look after people across the board, but young people in particular, I believe, should be guaranteed an apprenticeship. Thank you.
Can I come back?
I didn't let anybody else back, Tom. I'll be accused of favoritism, but you know, everybody's going to wish you well on your next job and after your historic innings as political editor of The Sun. Steve Swinford of The Times.
Prime Minister, China's role in this pandemic has been heavily criticised, and you personally raised concerns on our pages this morning about the impact of security laws in Hong Kong. Do you think we can ever return to business as normal with China, and are you, as is being reported, now looking to remove Huawei from Britain's 5G network entirely from 2023? And Sir Patrick, just a brief question to come back from what Tom was saying earlier. You seem to suggest that Sage previously provided advice on the impact of quarantine measures. Did Sage provide specific advice on implementing those measures on June the 8th, as is being planned, and whether that would doing so would actually make a significant difference to the spread of coronavirus? And if it didn't, do you personally have a view on that?
Well, first of all, on Hong Kong, I've said what I've said, which is that you're absolutely right, Steve. I do think that what is happening now is potentially going to be an infringement of the Sino-UK, Sino-British Agreement of 1987. It protects political and civic freedoms in Hong Kong. That looks as though it could be very, very badly eroded by what is being proposed. And so what we're saying is that we want to hold out our hand, a hand of friendship and support and loyalty to the people of Hong Kong. I think that's the right thing to do on high-risk vendors in our critical national infrastructure. You know my views. I think we've got to make sure that we have solutions for the UK that protect UK security, and that's what this government is going to achieve. But I want to stress one thing. I am a Sinophile. I think China is an incredible country and an extraordinary civilization, and I deeply disapprove of anti-Chinese xenophobia, attacks on people of Chinese appearance that we've seen in recent months. We must stamp out such xenophobia, and I see absolutely no contradiction with between what I've said earlier about Hong Kong and about high-risk vendors in critical national infrastructure, and wanting a good, friendly, clear-eyed working relationship with China, and that's what this country will have.
Again, I'll reiterate the advice that the experts from Sage gave, which is that the measures at the border are most effective when the incidence is very low in this country and when applied to countries which have higher incidence. And the judgment of that time, of course, is not something for us, it's something for politicians to make, and they make the policy and they make the timing decisions. But that's the advice that we gave in terms of the science of this.
Thanks very much. Thank you. Can we go now to Josh Layton from the Coventry Evening Telegraph?
To the Prime Minister, coronavirus has already taken a bigger toll on the UK than anywhere else in Europe. What specific reassurances can you give workers in Coventry, especially in the car manufacturing sector, which you've been so keen to champion, that they will not suffer the worst economic fallout as well? And to Professor Whitty and Sir Patrick, many parents in Coventry and Warwickshire are telling us that they are refusing to send their children back to school at the moment. With everything we have heard this evening about the alert level and the prospect of local lockdowns, doesn't this cautious approach prove them right?
Well, first of all, Josh, on your question about what we're doing to support the Coventry and the West Midlands, a huge number of businesses have received grant payments for about 42 million, I think, in Coventry alone. We're supporting businesses in industry enterprise in the West Midlands, and I think 85% of eligible businesses in Coventry in the West Midlands have received funding. But just, you mentioned the car sector. One thing we really want to drive forward as we come out of the epidemic, as we bounce back, I want to see a lot more going into green technology, green batteries, green motor vehicles, low carbon motor vehicles of all kinds. And we have, for instance, to give you one, we've just put 108 million into the UK Battery Industrialisation Centre, which is due to open later this year. So and you know, the West Midlands was the home of the original automotive revolution. That's where it all began, the internal combustion engine. And it's already in the West Midlands, you're seeing an incredible profusion of brilliant low-carbon technology, low-carbon vehicles. That's what we want to champion. That's the future.
I mean, on children, on parents not wanting to send their children to school, which I think anyone can understand why parents are thinking about this very hard. I'm going to give an answer in the way you would give an answer as a doctor, which is to say, if you're starting a drug, if you're recommending an operation, if you're doing anything of that sort, you say, look, there are some things that are benefits and there are some things that are risks, and you've got to understand these, and you've got to understand when is the right time where the risks and benefits have some form of balancing out. And of course, and this is not my area of expertise, I'm making the general point, children not having their school education is a huge disadvantage to them potentially for the rest of their lives. Everyone would, I think, broadly accept that. Set against that are the downsides of going to school in an epidemic. And I think that I'm going to list out four. The first of which is the risk to children. I think that one of the things that is one of the few reassurances that we can give in this disease is that overall it looks as if children are much less likely than adults to get severe disease, less likely to get clinical disease, meaning symptoms of any sort. Although there are tragically a very small number of deaths in children and a slightly larger number of people who've had severe disease, compared to adults, this is not a dangerous disease in the way that many other infections really pick out children. This disease does not. So this is not a disease which is primarily of risk to children. The second thing is that parents of particularly primary school children are generally not in the age group which is at high risk of getting severe problems with coronavirus. Now, there are people who've got particular high-risk medical conditions who are shielded at the moment, and in that situation there's a different set of concerns, and there's very specific guidance for those parents. But this is not an area in primary school. A very small proportion of parents of primary school children are in the age group where there's high mortality or severe problems. Clearly, there is a very complicated balancing act for society in terms of the possibility of increasing the transmission and on the one hand, and depriving children of their education on the other. And this is a very hard balancing act, but this is where we're trying to, as a society, walk between two risks, a risk to education and a risk to health. And the rates of transmission are now much lower than they were at the point when schools were closed. And then the final thing that people obviously think about is grandparents and others who are potentially at risk. And obviously there is an issue there which we need to think through in certain cases, and that's about people taking sensible decisions. So I think, I fully understand, as everyone fully understand, people wanting to think this through. But the point I want to go back to at the beginning is that the biggest concern for people is going to be the health of their children. And this is a disease which can affect children, but is very unlikely to compared to adults.
Thanks very much, Chris. Can we go to Marco Varvello of RaiUno? Mark.
Thank you, Prime Minister. Actually, I must thank you on behalf of the Foreign Press Association as well, which advocated for a while access to these daily briefings. And here we are. Thank you very much, Prime Minister. My questions are about the quarantine, because it's not just a matter of summer holidays. Hundreds of thousands of European workers left the country because of the lockdown, because shopping center, restaurant, pizzeria, they're all closed, so no work anymore. Now they are ready to come back. So I just wonder, they're not all key workers in NHS, but actually they are quite essential. If you think of any alternative, different way from the quarantine, health certificate or anything else. The second question, because you mentioned, the Home Secretary mentioned as well, air bridges and travel corridors. Does it mean that the British government has got already ongoing bilateral negotiation with the single European countries, and in case, which ones?
Okay, well, Marco, thank you very much. On the air corridors, I don't want to go into the negotiations that we're having, but clearly we're discussing with our partners around the whole of Europe about what could be done continuously, just as we've been negotiating the whole time about movements across borders, and it's one of the most difficult things to get right. And what I'd say to our Italian friends, Italians who've been living and working in the UK, who now want to come back, I say come back. Tutti benvenuti. Come back to London or to the UK, but you've got to quarantine. And I don't believe that is, everybody's been in lockdown for a long time. I know it's an imposition, but we've really got to defeat this virus. But we want you back.
Thank you very much.
Thank you. Thank you very much. Well, listen, I want to wrap up by I want to repeat the key point of this press conference. We are seeing continuous falls in the disease, in deaths, in incidents, and that's why we've been able to take the very cautious steps that we have. We want to take some more steps to unlock our society and try to get back to as normal as possible. Eventually, I would like to do such things as reducing the 2-meter rule, for instance. But all those changes, all that future progress, depends entirely on our ability to keep reducing the incidence and driving down that disease, and that depends on us following the basic rules: washing your hands, wash our hands, self-isolate if you have symptoms, take a test, and of course observe social distancing. Thank you all very much. We are beating this disease, and we will beat it together if everybody works on it together. Thank you.